This is GovExec Daily, where we bring you the federal stories that really matter. It's August 30th, 2022. I'm Rochelle Walensky. The COVID-19 pandemic has been going on for years, and new potential public health emergencies like monkeypox and a resurgence of polio threaten the American public health system. Against the very public COVID-19 failures of the Centers for Disease Control and Prevention, Director Dr. Rochelle Walensky earlier this month called for a review and potential reorganization of her agency in order to make it more accountable, more communicative, and more collaborative with its partners. Walensky told NBC News earlier this month about the ways forward, including taking stock of mistakes.
I think we need to recognize that in our big moment, our performance didn't reliably meet the expectations of this country, and that's exactly why I called for this reset, why I called for this review. And my goal really, as we hit this reset, was to have a new public health action-oriented culture that really emphasizes, as you said, accountability, that emphasizes collaboration with our public health partners across the country, communication to the American public, and timeliness with our information.
The agency has been criticized throughout the pandemic for bowing to political pressure. First, during the Trump administration to downplay the virus's impact, and later, during the Biden administration for moving too quickly back to some version of normal while the virus continues to infect thousands of Americans each day. Experts have questioned whether the agency changes will result in different outcomes, but like Walensky, most have acknowledged the change is necessary. Dr. Julie Swann is the department head and A. Douglas Allison Distinguished Professor of the Fitz Department of Industrial and Systems Engineering at North Carolina State University. She'll join me after a short message to talk about the potential restructuring at the Centers for Disease Control and Prevention.
When a shiny new technology pops up, when a newly discovered flaw exploits a bedrock legacy system, when Congress and leadership demand modernization but won't provide more resources, when every update is critical, you need analysis that cuts through the noise to tell you exactly what you need to know. Join the Next Gov team as we speak with relevant federal leaders and experts to break down the science, the tech, the policies, and the people behind the latest emerging technologies. Subscribe in the Apple Store, Google Play, or through your favorite podcast platform to make sure you get the latest critical update.
The COVID-19 pandemic continues to bring 100,000 new cases each week in the U.S., and the disease has taken the lives of more than 1 million Americans. And earlier this month, Dr. Rochelle Walensky, the director of the Centers for Disease Control and Prevention, said that her agency must of its pandemic strategy and learn from the many mistakes it has made over the past few years. Dr. Julie Swann is the department head and A. Douglas Allison Distinguished Professor of the Fitz Department of Industrial and Systems Engineering at NC State University. She joins me now to discuss the potential CDC restructuring and how the agency will go forward. Welcome to the program.
Thank you so much.
So I guess let's identify the problem. What have been the worst parts of the CDC response going all the way back to early 2020 to the present moment?
When we take it all in context, I think that there are a couple of things that stand out. One is the initial test that was rolled out for the coronavirus and how it was rolled out and the scaling up of that testing. A second issue has been communication and making sure that communication is consistent across different parts of the government, and that communication is also communicating what it needs to, especially as information changes over time. Another area that a lot of people are thinking about is data systems and what data is made available and when. And so that is something else that will also be addressed.
So where should that sort of focus on these changes be? I mean, you've sort of brought up the biggest issues, but going forward, how does that sort of get changed, and what can those changes be?
Great. So let's take each one of those and talk about them a little bit. We don't know the full details of the restructuring or reset, as it's being called, But we do know that there are going to be some changes in where the laboratory section of the CDC is reporting. We've also seen some adaptations in how testing has been done over the last couple of years. Initially, one test developed by the federal government that was rolled out. Later, several commercial laboratories and university laboratories rolling out tests. Again, we saw similar but somewhat different challenges during monkeypox with testing, but we saw a much more rapid change in strategy there. So we are starting to see some of those changes, some of which relate to the CDC and others of which relate to, say, the Food Drug Administration, FDA. So one element of that restructuring is where the laboratory section is reporting. And I expect that there will also be other things related to testing and laboratory, more than just the structure, but that's one of the pieces that we know publicly so far. A second area of restructuring is in communication, and that is a real challenge in public health emergencies, and it certainly has been a challenge during the COVID pandemic as well as others. The CDC has been criticized for sometimes inconsistent messages over time, such as around masks or around things like isolation periods or testing policies. So there is going to be a restructuring where there will be a communications office reporting to the director of the CDC. I think that there will also be a number of things in the restructuring and the development of the plan that will address what is communicated when, as well as how much uncertainty there might be, and perhaps even the why of some of the advice. If you take the specific example around masks, early on, there was messaging that we shouldn't be wearing masks, but really the message was more that we weren't entirely sure about the respiratory avenues, and masks were critical for frontline medical workers. And so that was really what was driving that initial set of comments around masks. And so if the public had really gotten a little bit more of that black box at that time, then we might have seen somewhat different actions around masks. Of course, it's always easy to look back with perfect hindsight, and it's much harder to do these things in the moment. The third area that I mentioned on data, the CDC director and the report lay out at least one change that we'll be seeing structurally, where the CDC will be using more preprints of articles before they are fully accepted and published. This means that that information, that research, that data can go out to the public more quickly. It does leave the CDC open for criticism if researchers don't like a particular article or don't like the assumptions embedded within it, but it does help push forward data and information more into the public sector to give that a greater opportunity for impact. I personally would like to see continued innovations on the data side and on the sharing of data by the CDC, both to researchers and to the public.
I think a lot of the frustration with the CDC, you mentioned it, has been a lot of the messaging and the communication. And I know I found that to be particularly frustrating, but I do acknowledge that the coordination aspect of CDC can be particularly difficult. We've got a complicated system of government with levels and local and state health departments that have to be involved in all of this. Can you sort of talk about that as far as the COVID-19 pandemic and how it goes forward?
Great question. In fact, the public health system in the United States is quite decentralized, as we sometimes call it. We have the CDC, we have other entities like FDA, there's ASPR as well that has a role in preparedness and response. Then you have state health departments, local city and county health departments. You have large providers like hospital systems. You've got pharmacies and their significant supply chains. You've got community clinics, federally qualified healthcare centers, and companies that are producing products such as vaccines, distributors such as McKesson. This really is a complicated system. And we don't have, for example, centralized data across that whole system, which is different than what you have in a place like the UK, which has a much more centralized healthcare system. And so they can see the information of all of their people and recruit quickly for clinical trials and gather information reliably about safety and all kinds of other things. So certainly in the United States, we have a very decentralized system that makes the coordination more complicated. It makes information sharing more difficult. And it also makes it more difficult to align objectives and incentives to achieve common goals. The benefit of it is that it does allow state and local health departments and their partners to really understand community needs and cultural differences and target distribution, response, communication, all of these things to the more local communities. And what works for New York City may not work for rural Alabama. And so, that is also an important part of this great nation of ours. But certainly the CDC, along with some other governmental agencies, do have a really complex task of managing both the preparedness in advance of public health emergencies, the response during the most active periods, as well as the recovery and the much longer term types of things that go on related to emergencies.
Yeah, the emergency management aspect of this, although not CDC specific, has certainly been a point of emphasis, I think, on a lot of the criticism, and I would say probably rightfully. Let's sort of end on going forward. What have you found to be, or what do you think will be the great challenges ahead for the CDC, both within the COVID pandemic and its effects on lessons learned and restructuring, and the pandemics we don't know about and the future ones that will have to be responded to?
So I will be happy to talk about those future challenges. I do want to point out, however, that we have achieved something that was really unlike what had been done before. We did have multiple companies come together, partially with government funding, where after decades of research previously, we were set up to develop and deliver a highly effective and safe vaccine. And so that is really spectacular. And I think that we'll be able to build on that success for future emergencies with faster innovation, platforms that allow us to more quickly respond to threats, not only such as public health emergencies, but perhaps also for ongoing ones like influenza, which occurs every year. But there are many challenges as we look towards the future. We have now had 3 major outbreaks that were quite significant in their own rights, with first the SARS-CoV-2 that causes COVID-19. Then there's been polio cases. The polio was declared an international public health emergency many years ago, and we were on the road to eradication, and now we have it back in the United States. And then monkeypox on top of that, with both a national and international public health emergency declared. So before, experts used to say, well, we might have a pandemic every 30 years, but we're really seeing that that is no longer the case for a variety of reasons: population, zoological, connectivity globally. I can expect, and we as a society and as government agencies should expect, that we are going to have continued outbreaks that really are going to threaten society in major ways that involve coordination and collaboration across government lines, across international lines, across state lines, across city and county lines, all of it. And we also will need to think not only within the US, but really internationally, because monkeypox has been around and we did not fully stamp it out. And of course, it's come into our borders as other things have as well. So we will see diseases coming more frequently and hitting us to a larger extent than before. We have a large population in the entire world is very globally connected. And so that does bring forward the possibility of new ways of spreading, like we've seen with monkeypox and others. I think we're going to need to continue to innovate on the side of our testing and our pharmaceutical treatments, as well as non-pharmaceutical treatments. Imagine if you were able to buy a kit at the local pharmacy and test yourself for multiple sexually transmitted infections, and it was automatically reported so that we could set up a whole system around reducing the impact of these, many of which are preventable diseases and treatable diseases, affecting not only those individuals, but also even unborn babies when there are pregnant women involved. So I would love to see the point where we take the lessons that we've learned from COVID around rapid testing and we build on that to really push the borders of medicine outside of just hospital walls and physician office walls, and really as far forward as we can in addressing last mile access for society. We're going to continue to see challenges in data and information. There is more new data being created now than ever existed in the world up to a certain point. And these sources of data are quite varied, quite different. Not all of them are created within our public health system. We've seen data sets from Google and many other companies and cell phone apps and all kinds of different things. And these are being utilized in ways that can help make our public health response more efficient, more effective, and more equitable. That last one, equity, that is another change that's in the restructuring plan. And I think we are going to continue to see challenges there, where for a variety of reasons, whether related to comorbidities or lack of healthcare access, we will see these continued gaps in outcomes, and we need to address those not only for SARS-CoV-2 and COVID-19, but also for monkeypox and likely polio and the next disease that comes along. We will also have to be looking at new ways of transmission. So right now we're thinking about respiratory diseases, but there certainly are other ways, including diseases that can be transmitted by insects, ticks, mosquitoes, and others. And those have different kinds of challenges than those that are transmitted by water, for example. So we will need to think about a wide set of things and a wide set of interventions that address not only the interventions that we see as individuals, but also those that we don't see, such as wastewater surveillance, ventilation, clean water, all kinds of other things. So it is a brave new world, and in many ways challenging, but there are also a lot of opportunities for how we move forward.
Yeah, that's certainly a lot there to take advantage of, certainly when it comes to the way that things are done. I know equity is certainly a emphasis on the administration, from the administration, and I know they've talked a lot about it in the presidential management agenda, and certainly the CDC is part of the administration, and hopefully will follow suit. Dr. Swann, thanks so much for being on the show with us.
Thank you for your time.
Thanks for listening to GovExec Daily. Our show was produced by Adam Butler and hosted by me, Rochelle Walensky. We want to thank Julie Swann for joining the program. Our music is the song Signals by Catfish Dancing. Be sure to rate, review, and subscribe on Apple Podcasts or Google Podcasts or anywhere else you get your podcasts. You can email us any feedback at podcast@govexec.com or hit us up on Twitter @govexec. We'd love to hear from you. We'll talk to you later.